So these are the 5 steps that you use to reverse an overdose. So once you've recognized it, you try to arouse the individual. This is a way of assessing, how, deep their loss of alertness is. Then you call 911 once you suspect, and you should err on the side of suspecting it is. You don't have to be certain. If you see any of 2 or 3 of those signs, if someone tells you that it's an overdose from heroin or painkillers, believe them. Err on the side of calling 911 and getting some emergency medical technicians there. You perform rescue breathing. We'll go over that. Then you'll administer the naloxone, and then you stay with the individual, hopefully as they wake up. But there's some things that happen when they wake up that we're going to make you aware of. So when you try to stimulate someone, the best way to do that is to go right to your breastbone. There's no padding on top of that bone. And if you take your hand and use your knuckles and just rub it hard, any individual who's semi-conscious will move or even open their eyes or possibly even activate muscle tone. So it's a very quick way. That's always an accessible place. And you do that just to assess, are they completely comatose? Are they semi-conscious? Are they unconscious? And you shake them and call their name as well. So you shake first, then you try to arouse them. So just shaking in and of itself is enough of a stimulation that goes to the brain that they might open their eyes or wake up. They might respond to their name. So if you don't know their name, ask for their name. And if you can keep them aroused, then do that. Keep stimulating them, and you'll be doing that as you go along. This is an example of a sternal rub with somebody in the upright position. So some individual might have used heroin or pain pills while sitting in a chair on a couch, and they could simply slump over on the couch. And so the best thing to do would be to assess their level of alertness right there sitting. Then at a later point, when you start rescue breathing, you're going to need to move them to the floor. Why would you call 911? Because there you have experienced persons who know how to manage an overdose, who do this every day, every week, all year long. And also because when you give naloxone, its duration of action when someone wakes up is not that long. It's about 20 minutes, but in some individuals, if they had a very high dosage, it could be a bit shorter than that. In some who had a low dosage or a high sensitivity to the opioids, it could last a bit longer. But it's very important to stay around and monitor to make sure that the individual doesn't lapse back into a state of unconsciousness, and their breathing slow down again. So there's definitely that risk. This is why those who get a certificate are going to be given 2 vials so that you could re-administer if necessary. And then, again, the awareness that if they don't wake up fully, you might suspect that they have other substances on board. This would be the other compelling reason to get emergency medical personnel there, because someone may need to breathe for them, and they have equipment to be able to do that. So what do you say when you call 911? First, you give your location, if you know the address. If not, you just give the name of the place where you are, such and such a mall, this neighborhood. If you know the street address, give that, and you describe what you're observing. So instead of jumping to the conclusion first, it's really better to allow the expertise of the 911 operator to be activated by you describing what you're observing. So you tell them, I'm seeing this, there's a person who's unconscious on the floor of their apartment or in the bathroom of their apartment. They're cold and clammy, they're not breathing very deeply. I can't arouse them. can you send some emergency medical personnel? And you tell the responders when they come there what you've learned by being present. If there are other individuals who are around when this person lapsed into unconsciousness and slowed down or stopped their breathing, you're constantly talking to individuals, and hopefully someone will come up and tell you, I know what happened. He or she OD'd on heroin or pain pills, or they've been using pain pills all afternoon and drinking heavily as well. So that's vital information to key into the individuals. And then you also need to tell them how much naloxone you've given and try to track when you gave it, so they'll know, about re-administering it. If you get an incomplete response to it, they're going to be more worried about other substances being on board, even if somebody says all they were using were pain pills or heroin. So when you assess breathing, you do this with someone being on the ground, and you look at their chest, and typically if you're breathing normally, your chest will rise and fall. It's very easy to see that. But in somebody whose breathing center has been partially or fully blocked, that chest may not rise enough for you to even notice it. So therefore the lungs are not being filled and oxygen is not going in. You actually put your ear over their mouth and try to hear whether there's airflow. So as the secretions increase, you'll be able to hear airflow even if it's slight. So looking would be the first way to do it. And then you can also just feel the chest and see if there's movement of the chest. So there are 3 different ways of assessing the level of breathing of the individual. So rescue breathing is a way of getting oxygen into the vital organs of the body, so to preserve the functioning of the brain and the heart. And it's simple enough to do. It's 1 breath every 5 seconds, and that's enough oxygen to keep a person alive until you can administer naloxone, and then hopefully you'll get a reversal on the first use of the nasal spray or the injector. So you lay them flat on their back. In order to open the airways up, you need to tilt the chin back. So typically you're going to put 1 hand on the forehead, use the leverage with that, with your thumb on the forehead, the top of your hand on the crown, lift that back, and then with your other hand, tilt the chin. That will open the airways so that when you go to breathe, you'll get very good airflow. Because just remember, if the neck is forward or turned to the side, there'll be a kink in the airway and not enough of your air will actually get in to have the oxygen go to the vital organs. You also look to see if there's anything in the mouth of the person. So it could be that they passed out when they were eating, or they had a piece of chewing gum in their mouth and then they lapsed into unconsciousness. You want to make sure that there's not something obvious right in their oral cavity, and if there is, you simply remove that by just sweeping your finger in there. You got to be careful that you don't push that down into the lower airways. So the step-by-step process is then you pinch the nose so that the air doesn't go in the mouth and out the nose, and then you use your mouth and cover the mouth of the individual, and you give a full sustained expiration, and you should actually see the chest of the individual rise. If you don't see that, or if you feel a whole lot of resistance, it may mean that you need to reposition the head to open the airways. And so at first you're going to do 2 quick breaths just to make sure that the airway is open, and then you go into rescue breathing, which is a breath every 5 seconds. So you can do something simple like breathe 1 Mississippi, 2 Mississippi, 3 Mississippi, or whatever way you count seconds. You could tap, you could talk, you could have somebody else, a bystander, help you do that. And this technique is vital to getting some oxygen in, because you may not know how long the individual has had their breathing blocked or slowed down, and so you want to do this for a bit before you administer the naloxone. So just to get some extra oxygen in before you give the naloxone, you give 2 additional quick breaths so that you have time to assemble the naloxone nasal injector or the needle that you'll use to inject into the muscle. And then you've got oxygen that's still in the system. So there are separate sections of this video that are demonstrations for both the nasal spray and injecting into the muscle, and those I think will be informative to you just to see how to do it. So it's one thing to describe it, it's another thing to see how to do it, and then you're going to need to demonstrate this if you want to get a certificate. So the knowledge piece of this is in the video, but then the practical side of it, knowing and having confidence that you could do this in an emergency situation where your anxiety level might be up and so might those of family and friends around you. So you want to practice it enough so you get good at it. And it's it's just worth watching the videos to reinforce what the slides say. So what is naloxone? It's been around for more than 50 years as well. And it goes to the same mu receptors in the opioid circuits of the brain, except it's very aggressive. It's a little bit like the bully opioid. It just knocks its way into the receptor in the circuitry, and whatever is in there that's causing the level of alertness to be too low and the breathing to be shallow or shut down, it will just kick the painkiller or the heroin right off that receptor. And it does it very quickly, and sometimes you can get an extremely dramatic reversal of the overdose, literally within 10 to 15 to 20 seconds if you inject it, say you were in a hospital, injected into a vein, because the liquid form can be put into a vein. But out in the community, when you use the nasal spray, it still gets in surprisingly quickly. There's no abuse potential to it. I'm not even aware, after 30 years as an addiction specialist, of any case of misuse of naloxone. It saves lives. It's not something that you should worry about if you have an overdose. There's no toxic effect from giving it if the reason that the person is not breathing is from an overdose of alcohol or a sedative. So it's worth giving it because it has literally no toxicity. It will wear off in as little as 20 minutes, but it may last 30 to 40 to 60 to 90 minutes, hopefully longer. And that's why you stay and monitor the individual until emergency medical personnel are able to take over. So naloxone is called a narcotic antagonist. If you think of the example of snake venom, there's the venom, which is harmful. There's the anti-venom, which reverses the toxic effect of the snake venom. So the full agonist, painkillers and heroin, their effects are reversed by the antagonist. So a similar concept to what you might have heard about with a snake bite. It works just as I said by finding those receptors, especially those mu receptors in the lower part of the brain where the breathing center is, and very quickly displaces and moves aside anything that's in that receptor triggering the negative effect. So if you are given a prescription, you just need to pay attention to how you store it. You wouldn't want to take it out of the box and leave it in your windowsill because it's light sensitive and it's heat sensitive. So you keep it like you would other pharmaceuticals in a safe place that's dark and roughly room temperature. All medications, this one included, have an expiration date. It's printed right on the outside of the box or usually on the label of the prescription, and you need to pay attention to that. So if you have it, it's past the expiration date, then you can typically go and exchange it at the pharmacy for a replacement prescription, or you may need to get a new prescription. In terms of disposing of it, if you no longer in need of it, you can typically take it to a local health department or a pharmacy and they'll dispose of it for you. Don't throw it in the trash can, even though it's not dangerous. It's just not a good idea to have an apparatus that has a needle with it. So let's talk about the administration of naloxone through the nose. So it'll come in a box. It'll have the three pieces that you see to the right there. There'll be the syringe. There'll be to the far right the little nasal adapter. And then in the middle, that's where the medicine is, the active ingredient. So there are 2 milliliters or 2 cc's. Each milliliter has 1 milligram of naloxone. You have to assemble this, and there are steps to doing that. So the syringe itself will have a yellow cap on the top, a yellow cap on the bottom. You remove those. You take the atomizer or the adapter, screw it into the top, and you'll feel it just secure itself down. It's maybe a half turn to get it to screw down and lock in place. And then you've got to flip the cap. Could be red, could be another color, but it's a distinctive color. You pop that cap off the vial where the active medicine is, and that's going to go into the syringe, and the rubber inside the vial will go right onto a little needle inside the syringe, and you'll feel, if you insert it and do a little bit of a twist, you'll feel a bit of a pop. So you don't want to jam it in there, because if you do that, you'll start to actually send the liquid out. So you do it very carefully and slowly, and you'll feel that little pop. And then it's ready for use. So you tilt the head back just as you did with rescue breathing to open the nasal passages up, so that when the spray, the mist goes in, that adapter, that atomizer actually turns the liquid into a mist. And so it's broken down into little droplet. It goes into the nasal passages, which has so many blood vessels, it's absorbed very quickly. That's why this is an effective way of giving this medicine. Sometimes it's a better way than giving an injection in a muscle, because if you've had your breathing slow down and your heart rate slow down, you're not getting blood out to that muscle, but you're still getting blood preserved to your head and neck, because that's the most vital area of the body. And then you wait to see if it works. The reversal will be very clear cut, unless the individual has other substances on board that could be blocking respiration or lowering level of consciousness. If breathing is not restored in 3 to 5 minutes, then you're going to administer the second vial. So you assemble it just in the same way. And sometimes it takes a second vial. That's because there's such a high level of toxicity that you haven't bumped all of the heroin or the pain pill off the receptor. Again, I encourage you to watch the demonstration video. I think that will reinforce the steps that you need to take. Then we have the injectable form. That's a liquid that you'll use, a typical syringe that you might have had someone who draws blood from you use, and you'll be drawing up the liquid into the syringe and injecting it into one of 3 muscular areas of the body. So the first step would be to pop off the covering cap of the bottle which contains the liquid in it. Then the syringe may come already assembled. Typically it's already assembled with the needle on it, has a cap on the needle, so you just open up the syringe, draw up the liquid 1 cc. So this is a little bit stronger in strength than the nasal version. So you're going to be giving 1 cc instead of 2 cc's. And then you'll inject after you wipe down the area. So the kit that you'll get will have a syringe, an alcohol pad, as well as the bottle which contains the active ingredient. So you inject by going straight into the muscle. Sometimes it helps to raise the muscle a little bit, particularly if you're going to use the shoulder muscle, just below the point of the shoulder. The others, the muscles are big enough, in the thigh and in the buttocks that you don't have to do that. If the individual's on the ground, it may be far easier just to use the thigh muscle. And you push all of the liquid into the muscle and then you withdraw it. So you want to go just deep enough below the level of the skin to get into the thicker part of the muscle. So again, you allow 2 to 3 minutes, a little bit shorter period of time. So if the individual still got a good pulse and that blood is flowing to the muscles, injecting it in the muscle may be a bit faster, but it's not that much faster. So some areas within the state are going to be using the nasal way of delivering naloxone. I think it's less scary to individuals to use a nasal spray than it is to have a needle. You might get so alarmed by that you might freeze up and not deliver the needed medication. I suspect in Maryland nearly all the jurisdictions will be using the nasal spray. And then again, if you don't get someone to wake up, if you don't reverse the overdose, then you a second time with rescue breathing in the middle, as you're waiting for them to wake up, and then you stay with them. So these are the 3 sites. As I said, there's a video that you can watch to see these 3 sites maybe a little bit more clearly, but it's in the middle of the meaty part of your upper arm, on the outside. This is where you would typically get a shot if you go to a doctor's office or a hospital. Then it's on the meaty part of the upper thigh to the outside of the middle of the thigh, and then the upper outer area of the buttock. And you can just feel around and quickly notice that there's a good thick muscle mass there. So if you have to leave the person for some reason, maybe you left the second vial in your car and you want to give a second dosage, then you would need, even if it's just going to be 30 seconds, you need to put them into the recovery position, which we'll show you in a minute. That's to prevent them from being flat on their back and maybe waking up and vomiting and having their vomit go into their lungs, which is a very dangerous thing to have happen. So we'll show you the recovery position, but you're going to roll them over onto their side into a stable position. This keeps the airways open, the fluids draining out, and if they do vomit, they vomit straight to the ground. So this is the recovery position. So if you're there attending to the individual and they're flat on the ground, you're first going to take one of their legs, bend the knee up to a 90-degree angle, and then just roll it over onto the ground in your direction. So you can see at the bottom how the knee is supporting the middle of the body and the lower body. And then you're going to take the hand and place it up under the cheek, and that way you get the arm stabilizing the head and neck and the leg stabilizing the center of the body and the lower extremities. And it's a very stable position, and this is what you would do if the individual woke up as well. If they start breathing but they're still a little bit out of it, you can put them into this recovery position in case the medicine works a little bit more and they wake up a little bit more. So when they wake up, as I said, it could be very dramatic, suddenly, within 10 or 15 seconds they go from unconscious to fully awake. They're probably going to be disoriented. They won't remember what happened to them. They might suddenly feel ill because when you knock all of that painkiller or heroin off those receptor circuits in the brain, it could throw them into withdrawal. So nausea and vomiting being a withdrawal symptom, that could happen. And so you want to be prepared for that. They could just feel bad too. They can be disoriented and maybe at first just thrash about, so you want to be prepared for that. So just in a calm voice with a touch, just be present and tell them, I'm here, you're safe. It's very rare to have a seizure, but it could happen. More often the seizure would be from something other than an opioid. It would probably be from cocaine on board as well, or alcohol or benzos on board. But it could happen just with opioids alone. And that placing someone on their side in that rescue position is exactly what you would do if they were having a seizure. And if they have a strong seizure, you can just stand above them with your feet on one side of their body or the other is a good way to control the severe movements. So in caring for them, you put them into recovery position. You're waiting for medical care. If it seems like it's too long, you either call again and get an update, or you ask a bystander to call again and get an update on where the emergency response team is. Recovery position. If they're fully awake and they're able to sit up, you can sit them up. You just need to observe them to make sure they don't lapse back into a lowered state of consciousness or back into coma. And then, as I said, you keep them calm. So what don't you do? These are some strategies that you might have heard about that you can use to bring someone out of an overdose. So you don't cool their body down because they're already not getting enough blood supply to an organ, and it slows down your heart rate. It could even trigger an abnormal heart rate. You don't put them in a bath or a shower. I actually have a woman that I've treated now for 7 years who overdosed in an apartment with 3 or 4 other people. They dragged her into the shower, turned on the cold water, and left and called 911 on the way out. And luckily, a rescue team came there, gave her naloxone, and saved her life. And she's got a wonderful life now. And when you experience something like that, where you hear or know or participate in a reversal, it touches you in a special way. So you don't put them in the shower. They could get too cold or they could get burned. More often you would worry about somebody getting burned. You don't burn them with a cigarette. You don't stick them with a needle. You don't pinch them hard. You're not really going to do anything injurious by doing a sternal rub. But if you pinch someone real hard, you can actually cut or bruise them. And so you definitely don't want to use an extreme pain-inflicting measure. You don't really want to give them a drink anytime, even if they feel thirsty, because if they lapse back into a semi-conscious state, that liquid may go into their lungs rather than into their stomach. And so you don't inject them with anything else that might be around. Like if you said, well, I know how to inject cocaine, let me give them a stimulant, that'll wake them up. Well, actually, it won't wake them up. It'll just, race their heart, tax their system even more. So here are the key points. You've determined that there's an overdose, you call 911, and you begin rescue breathing. You deliver the naloxone, the reversal agent, the antagonist, either through the nasal spray or by injection. You may have to administer a second injection, and you stay there until you can hand over the care of the individual to emergency medical personnel. And just prepare yourself and maybe ask for assistance if someone does get agitated. So it's always nice to have another person around, just to assist you in this regard.